Wonderful. Welcome, everyone. Really nice to see so many of you back. Really nice to see names becoming a little bit more familiar each time. So welcome to the next BESSI webinar, which builds on the last one we had. I'll go into the agenda for today a little bit more in detail in a second, but we'll do a very quick round of introductions of some of the main speakers that you will hear. So I'm Marijke Scholmeris, and I will be facilitating again today, but also leading one of the working groups. So I hope we'll get to speak more later, and I'll hand over for a quick introduction to Susan Mickey.
Hello, I'm Mickey, and I'm a Professor of Health Psychology and Director of the Centre for Behaviour Change at UCL in the UK.
Maybe Atle, do you want to introduce yourself?
Yes, thank you. My name is Atle Fredheim, and I work as a research director at the Norwegian Institute of Public Health.
Fantastic. And Jake?
Hi everyone, welcome. I'm Jake Crouch. I'm a postdoctoral researcher at the Ottawa Hospital Research Institute. So behavioural scientist researcher helping to coordinate the BESSI collaboration. Nice to meet everyone.
Great. And then Ray, do you want to quickly introduce yourself?
Hi, I'm Ray Thomas. I work for the Institute for Evidence-Based Healthcare in Australia on the Gold Coast. I work with the BESSI collaboration and do my best to improve the BESSIs globally.
Thank you. And then we have a special guest today who will give us a little bit more insight into recent developments and thinking in the WHO later. So you hear more from him later, but I wondered, Tim, whether you could briefly take this moment also to introduce yourself. Thank you.
Thank you. My name is Tim Nguyen. I'm a unit head for high impact events preparedness here in the Health Emergency Program in WHO. So in my portfolio, I have a couple of things that is more, looking at global preparedness tools and what we need to do better. And one of the activities now included in my portfolio is assessing the impact and effectiveness of various public health and social measures, and see what we learned from the current experience to prepare for the next one. Over.
Great, thank you. We'll hear more from you later, Tim. I wonder whether maybe when you speak, Tim, whether you could come a little bit closer to the microphone, because it was a tiny little bit difficult to hear. So just a bit of adjustment might do all the trick. Thank you. Well, as I said, we'll get to Tim in a second. I also wonder whether I don't want to do all introductions because it takes a lot of time, but maybe we can pick two people to turn on their video and give us an extra introduction of who they are. So I'm randomly selecting, how about Lau Wing Yan? If you can hear us and are happy to put on your video, we'd love to see who you are and get an introduction. Maybe that's not possible right now. So, oh, there, yes. Fantastic.
Sorry. I can't put myself on camera, but I'd like to introduce myself. I'm a PhD student in Hong Kong, Polytechnic University. I'm doing things related to behavior change will. So I'm really interested to learn more about all the experts in this field. Thank you very much.
Fantastic. Welcome. And maybe the second person to quickly introduce themselves is Lars Hemkens.
Hi, I'm Lars Hemkens. I'm a clinical researcher at the University Hospital Basel, and I'm looking at BESSI trials and other trials with the COVID evidence platform.
Great, fantastic. Looking forward to hearing more from you as well. So the plan for today is the following. Last time we spent kind of workshopping ideas and sharing insights into what people have found really useful about this fledgling community around the BESSI collaboration over the past year, but also what would be useful next steps. And there were a lot of really valuable ideas shared. I'll go back to those in a second later. We've kind of condensed them into what we think could be 5 priority areas in which we should build the BESSI collaboration. But what exactly it means to build those 5 priority areas is still a very, very open field of discussion. And today really is a day for us to have these discussions in working groups in the fields that you might find particularly interesting, but also crucially, where you might feel you could channel some energy, whether there are certain parts of building this collaboration that people would be interested to be a bit more involved in. So while it is a very open discussion as ever, our goal really is to try and find very concrete ways to build this community that has been so diligently coming together here, and to make sure we have some sort of foundation to really develop shared priorities and take some next steps. But before we go to those more concrete discussions, we have three quick things we want to share. One is Susan is going to give a brief overview on the continued need for the BESSI collaboration and also where things are and what has happened since we last were together. We then hear from Tim Nguyen from the WHO on recent thinking in the WHO and kind of developing perspectives there. And we hear from Atle about continuous, Norwegian developments in the BESSI fields, which are going from strength to strength, really. So without further ado, I'll hand over to Susan Mickey to give us an updated insight into why BESSI collaborations continue to be so important and where we are, really. Thanks, Susan.
Thank you. Can you see the screen all right?
All good.
Yep. Okay, very good. So yes, just to remind people that BESSI aims to foster a global interdisciplinary research program and translate the evidence coming from that research into policy and practice. And it's aimed both at reducing viral transmission in the current pandemic, but also longer term to reduce the likelihood and impact of future pandemics. So we believe, and I think it's patently obvious, that BESSIs are a cornerstone of managing pandemics and preventing future ones. However, we know from evidence that less than 5% of all the funds, research funds on COVID-19 globally has been on all of BESSIs put together. That's behavioural, environmental, social and systems interventions. Yet, and I say some decision makers continue to recognise the importance of BESSIs. So this is really the problem we're trying to address. How to convince funders that there's research that needs to be done and how to help support and facilitate that. Just recently, Tedros talked at a press conference and said, quite rightly, vaccines alone won't stop the community transmission. We need to ensure that people follow the public health measures, like using masks consistently, being in ventilated spaces, hand hygiene, respiratory etiquette, physical distance, avoiding crowding. So, very clear that there's not one silver bullet here. However good the vaccine program is, we need all these other things. We need to carry on, and what we need to do is to bring disciplines together that haven't often worked together, and be able to generate research that can be implemented at speed during outbreaks, and also to set up infrastructure for research to be done at speed. And part of what we want to do is begin to develop the kind of research agenda that's needed. I'm not going to expect you to read all this, but just to say in a very collaborative consensus way, we've been communicating with all the people on our JISC mail service and through Twitter, and boiled some of the main principles down to these here. But so that we can get on with other things, I shall leave it there, but it will be on the recording of this, and I'm sure it's on our website for anybody who wants to look at these in more detail. Thank you.
Thank you, Susan. I would expect everyone to know the BESSI principles off by heart by now, right? So Tim, I'd love to hand over to you, because obviously the press conference that Susan has just referenced for the BESSI community was a kind of electrifying moment. I mean, it really was. Atle sent around the link and saying, watch this now, it's happening. And I jumped up from my chair and thought, yes, it's being formulated at the highest level and really visible to, and audible for everyone. The point that there is not one silver bullet, that while vaccinations are incredibly important, it cannot be just vaccinations. So I wonder whether you could take us through on some of the thinking that's happening on this line of argument within the WHO, what maybe you've seen changing, or what are some of the latest updates. So Tim, thank you very much, and over to you.
Thank you, Marike. Can you see my screen? My slides, great.
Very good. Yeah.
Well, I'm very happy to be here because I think I'm preaching to the choir here on the kind of activities you want to do and really see, where we can take this forward jointly. You know, in health emergency, you know, we see it all over again, not only in this pandemic, but every kind of infectious disease outbreaks, that non-pharmaceutical interventions or public health and social measures, you know, however we call them, is the first line of defense, you know, for every community and every individual, and they are being applied. But what we lack is really some of the evidence, how they work in which combination and for which diseases they work better or not. So I think this is really sets out the tone where we're looking at this project. So and that's you know, the point we so see, you know, with other outbreaks where we have pharmaceutical interventions, even then, you know, we don't have it at scale and we don't have it in time, especially when we're talking about low and middle income countries. So we have also a huge distribution and equity problem when it comes to this. So again, those non-pharmaceutical interventions is still something that we can apply at scale, but we need to better understand, you know, in which way we can do this. We often talk about this Swiss cheese model of layers of different interventions. And basically the message is, you know, we don't know how each layer works actually, but we believe that the combination of layers, you know, is the best approach to applying non-pharmaceutical intervention. And this is something I think the trick that we would like to change in the future, that we have a better understanding of representing the Swiss cheese model and really have evidence, numbers to really say, you know, you do this in this combination in this setting, because we also understand these interventions work differently in different settings. You know, if you're in sub-Saharan Africa, when you share with 10 people a room, physical distancing is a bit different than when we do it, you know, in a high resource setting. It's really different if you don't have running water, you know, to wash your hands, and you know, water is limited, so you rather use it for drinking, cooking, but probably not for hand washing. So we also need to take that into consideration, that the effectiveness and impact of this vary, you know, in terms of timing, setting, and population. And we also see it over and over again. You know, countries are at different speeds of the pandemic. And then in some settings now, certain measures work probably better than in other settings where they have a different transmission scenario. And really making people understand that these factors that, you know, are important when we look at these interventions, just not have blanket, you know, recommendations and issues. So this is really a call and need for us to better look at individual interventions and the combination of interventions, and in combination with pharmaceutical interventions. And I think this is the big work that needs to happen over the course of the next few years, to really learn from this natural experiment that is actually happening at the moment, and really collecting that data, that information that we are able to apply for the next epidemic, but surely for the next global pandemic, and deriving, you know, what we see in this natural experiment, and then can give to policymakers, you know, in the next generation, when we, you know, hopefully have a pandemic in the next generation and not in our generation again. We can build a lot of our work on existing work, you know, from the pandemic influenza preparedness work. There is already some recommendations to some of these interventions. But then again, when we looked at this and collected the evidence was still scarce at the time for influenza. And also some of this recommendations based really on weak evidence, or really on a risk-based approach rather than an evidence-based approach, you know, in terms of applying these interventions. You know, I'm using, you know, some of your work and really, you know, making the case here that when we compare pharmaceutical versus non-pharmaceutical intervention, there's just a huge knowledge gap in terms of funding that invested, as Susan was already, you know, having this on her slide. But we just have this, you know, huge gap in drug trials, and when you look at the BESSI trials database. So this is something we need to close the gap and provide those evidence for informed decision-making, evidence-informed decision-making to policymakers. Because in the end, you know, this is the call we heard from ministers that, hey, we want to apply these public health and social measures, but we also, you know, need to have the evidence to convince our population. that what we're doing is the right thing. Now, we also need to share that knowledge with our population so they understand when and how we are applying measures, when are we introducing, and also when we are lifting measures, and have really trust built in the response. And trust is often related to having good evidence and something that people understand why it's being applied. So we have a 3-year project that has been starting with the press conference that we want to really have 3 objectives in the next 3 years. First one is really measure the effects and impact of different public health and social measures and their intervention burden. Because while some of them work in terms of breaking transmission, they also have a negative impact on economy, on mental health, so other health indicators, and on society at large. So the question is, can we also measure those intervention burden to give the full evidence to decision makers on understanding the application of these measures? This second is really, what I was already saying, there is negative impact or intervention burden, and how, we can also understand, trust as a broader concept of this. We see, in some settings, we know it works, but at the same time, if the public doesn't trust it, then, those measures are no good. And the question is, how do we also understand, trust levels of population that have to apply this intervention, and also understand, how that interplays with acceptance of certain measures. And the third goal is really to establish an international coordination cooperation mechanism, because we know a lot is going on, but we don't see it. We know that countries are investing now in research, in interventions, and probably collecting the data. But we need to build a system to systematically collect this and gather this evidence. Right now, it's a natural experiment, and we cannot miss this. And we're looking at this like the way we do the Unity study on testing. That really let's pool evidence and knowledge that is being conducted by different research teams, and have it somewhere in that is accessible to everybody, so we can build a systematic living review around some of these interventions and really progress on knowledge about this. So we have like a kind of work plan set out for the next 3 years. So first one is we will establish a technical advisory group around this to help us progressing some of these activities. We'll be hopefully either ourselves conducting some global evidence reviews, but also gather those evidence reviews done by others to have it in a one-stop shop. Next thing is, work packages, norms, and standards. So can we issue out research protocols in health emergency that are ethically and legally also acceptable in countries to be conducted? Now, one example was when we introduced the experimental Ebola vaccine during the 2014-16. How do you do and issue Ebola vaccine in an emergency that is not licensed or approved yet? So that's also a time when we as WHO with partners created a research protocol to apply this in a research setting. But this, had to go also through ethical clearance, to legal clearance. But having these protocols in place is really helpful during health emergencies to conduct some of these interventions and understanding this. And I also understand that some countries were challenged during this pandemic to do certain interventions and studies in a randomized controlled trials because such ethical protocols did not exist or were accepted. And so, for example, doing school closure or in one setting and not doing school closure in another setting, that was, challenged in some countries to do such, kind of research design. And fourth thing is really, we want to build a global monitoring system really on when countries are applying certain measures and getting understanding about how that has contributed to certain lifting or certain breaking of transmission. We did this already now in the pandemic, and we saw that the peak in certain areas like India at the moment also were related to that weeks before certain mass gathering measures were lifted, and then weeks later you see then an uptick in cases, And the question is, can we build such a monitoring system to also understand when certain measures are being introduced or being lifted, and what impact does it have on transmission cycles and on the epidemiology in general? So that's really a very quick turnaround what we're planning in the next 3 years. It has all started at the moment, so things are being really designed. In the chat, I put 2 things for you also to understand, to consider. First, there has been a WHO resolution this May around pandemic preparedness and response, and one of these activities relate to this work in terms of building the evidence for public health and social measures. And second is a vacancy announcement. So I'm recruiting a senior team leader in my unit to really lead on this work and be the technical focal point for folks. And I already have 2 people recruited, but I still need, a senior technical lead for this area to help implement all of these activities. I stop here. Thank you.
Thank you very much, Tim. I want to leave a little bit of time for questions to you, but before we go back to you, I want to, as the person on the Norwegian side, with some of your thoughts and how you see things play out before we go back to some questions for Tim. I think you're still muted, Atle.
I'll quickly just present our plans. Okay, you see it? Great. So as Tim, or as you could perhaps interpret from Tim's presentation, there are things going on in Norway at our institute, Norwegian Institute of Public Health, that is closely related to the initiative that Tim just presented in WHO, where there's a sort of common history behind this. And so basically, I'll present what our plans and our ambitions are for what is being called a new Center for Epidemic Interventions Research. In relation to the support that was decided to be given to WHO's work in this area, the Norwegian government also decided this spring to allocate monies to the establishment of this center. So, which is basically a center to do research on BESSIs for epidemic or infection control at our institute. So that was great news for all of us in the BESSI community. It means that at least some money and some people will be allocated to this area for some years to come, hopefully till I retire. And that's actually realistic, so we'll see. But that's it's really great news. So we've set up 3 goals that are in line with the expectations from our government for this center. And you'll see, which is obviously not coincidental, this overlaps largely with the goals that Tim just presented for the WHO initiative. And it overlaps beautifully with the goals of the BESSI collaboration as well. So there are lots of common interests in this area, I reckon. The 3 aims that we've set up for this center are: 1, to prepare for the conduct of studies of effect of non-pharmaceutical infection control measures, and that we will do that in collaboration with WHO and others. This feeds directly into the point that Tim made about preparing protocols, ethical clearance principles, etc., etc. And then actually carrying out effect studies, which was also on Tim's agenda. And then finally, the 3rd point, which is one of the BESSI collaboration's goals, and perhaps not as explicitly, but obviously implicitly a goal of the WHO initiative, is to use the evidence generated in a way that can support decision making. And so we have a specific aim in that area to do work, to do research on interventions or activities or measures that can support that process of using research in an informed way by those who make decisions. So just quickly details on those aims, or actually I won't. I'll just skip through these and you can have a glance. So these are just some specifications of what we plan to do to prepare the conduct of studies. Here are some examples of what we mean when we say that we will carry out studies. We're including randomized trials, quasi-randomized trials. We're putting emphasis on the need for qualitative process evaluation, etc., to understand what's going on. All the usual stuff for people who are involved in trials of more complex interventions and that sort of field. We're also interested in doing more maybe you could call it lab-oriented. I'm not talking about the viruses, but more computer lab type studies where you can compare how people respond to different presentations and that sort of stuff. That might be interesting for communication strategies in an epidemic situation. Yeah, I won't go into that. So finally, I think it's made clear, we are specifically tasked. It's our job to support the WHO initiative. So Tim has the right to expect that we support his work in that initiative. But clearly, we are very keen to continue the work with collaborating with anyone out there who's interested in this work, and that's why it's been so important for us and for me to be actively engaged in the BESSI collaboration. Thanks.
Thank you very much, Atle, and again, thanks, Tim. I wonder whether there are questions specifically maybe to Tim, but also to Atle from anyone in the audience. I have quite a few, but I don't want to abuse my privilege and go first. Anyone has any thoughts, any feedback, any questions to Tim or Atle? Then I will go first. Tim, I found that really fascinating, what the kind of glimpse that you gave us. And obviously, yeah, as you said yourself, right, you were preaching to the choir a bit. But I think one of the things that has been a really huge learning experience for me over the past year, and I come from one of the disciplines that is traditionally not part of this, anthropology and political science, but you mentioned that we are now so aware of the huge knowledge gap and that this need to close it is so acute. And yet we have really found out how difficult it has been for us to not just convey that need, but actually put more and more things into motions of the kind that have now been put into motion. And I wonder whether you can actually give us a bit more of a glimpse into the kind of office talk in the WHO. How difficult really is it within the WHO in kind of common debates and meetings to really bring home this perspective, which I assume is still very much dominated by another more clinical, more medical perspective? Thank you.
Thanks, Marika. I think here internally in WHO, we're quite aware of the need of these non-pharmaceutical intervention and how to apply this. I think what was really lacking is, when the process of developing WHO guidance always, based on, what has been published and then pulling this and coming to a recommendation. And when there is a lack of this evidence, then, you always have weak recommendations based on, the available evidence that you can pull. And this is, I think, already pre-pandemic, a huge knowledge gap, and that has become more aware of people seeing it because now they have to apply it, and they're realizing, that we have, as a community, invested too little in understanding better these non-pharmaceutical inventions compared to the big investment that is being done, for pharmaceutical inventions, also due to the registration system that you need to produce that evidence in order to get market authorization and to get, from the medical regulatory agency your permission. So this is already, in the system set where, you have this a big knowledge gap. I think now we have an opportunity. First, we have a resolution by member state that have acknowledged that this is a problem and needs to have investment. And we have now an opportunity with the pandemic, with all the evidence that's being generated. How can we harvest this to build on future recommendations? But again, we kind of also lack, standard protocols on how to conduct this. And this is also something I hope, we as a community can contribute, that this can be better and systematically collected. But from a public health perspective and practice here in WHO, and you have heard it in several of our press conferences, we really balance the use of vaccines, but as well as hand hygiene, wearing masks, ventilation, and those measures as well. And this is something, you know, we need to undergo with more evidence in the future. And this is why, you know, we're setting up this initiative. Over.
Thank you so much. Yes, let's grab the opportunity. Susan, I see your hand is up.
Yes, Tim, thank you. That was really great to hear about this important work, and I hope that some of us can contribute to your new technical advisory group. I was also really pleased to hear the terminology that you're not going with MPIs. I always have a real issue about defining things in terms of what they're not, because it doesn't actually say what they are. And I think public health and social measures is much better. We, the BESSI collaboration debated long and hard about what to call what we're talking about. Certainly public health and social measures covers the E, S and S in BESSI. What it doesn't include is behaviour. And obviously behaviour is absolutely essential to all of what we're talking about. The problem about not mentioning behaviour is that often people don't conceptualise a lot of what we're talking about. For example, test, trace and isolate in terms of behaviours, but they actually are behaviours, to get tested, to give contacts, to isolate yourself at home. And the problem about not having behaviour up front is it means one doesn't then automatically draw on behavioural science. And there's a huge body of very helpful behavioural science. So I just wondered what your reflection is about how you, given the terminology you're using, going to keep behaviour sufficiently upfront in your thinking. And I should declare that I am a behavioural scientist.
This is well, because I just went through this terminology issue discussion internally, because you have these schools of thoughts always, these NPIs, PHSM. We also try to introduce at one point public health and social interventions, but this was also very hard when you're stuck with certain belief systems and paradigms, and I think we must have this paradigm shift as well, because I really also believe what you said, Susan. Behavior is the underlying issue here. If people want to change, and they all have changed in this pandemic, the way actually you see in Western world people wearing masks and also willing to wear masks, whereas before the pandemic it was often kind of like an Asian thing, a cultural thing, that oh, we don't use masks in public settings. I heard something very nice a Japanese colleague said the other day. When I feel a tickle in my throat, I wear a mask in the tube, because this is my sign of respect to others.
Yeah.
And so this is not something forced, I have to wear it, but I want to wear it because this is good social practice, and I show respect and I want to protect others. And I think this is something also important we need to integrate. And that's why I said in my production, it's not only looking at reducing transmission as an outcome, but how can we also understand the societal impact and the trust aspect of individuals into these measures. Because I believe when they trust and understand, the behavior change or the adoption of a new practice is different when it comes from a top-down, you have to. And I think how we can measure or make that understandable will also be, personally for me, an important part of this work.
Yep.
Thank you, Tim. Paul, I saw that your hand just went up. I wonder whether you could be really very quick, because we need to really go into our working groups.
So I was just going to concur with Susan, and it's all sorts of behaviours, including presenting for testing in Australia. About 50% of people with COVID symptoms were not getting tested, at least early on in the pandemic, but also things like quarantine and self-isolation behaviours. So we think of the thing you need to do, but then there's always a behavioural component, and that's echoed in about half the trials in the BESSI collaboration database are behavioural ones. Thanks.
Thank you. And again, thank you very much, Tim. And I want to now take your lead to say we have an opportunity here. And I want to very quickly sort us into working groups, but give you a little bit of background of what this looks like. So I have put into the chat a link to the Jamboard that some of you contributed last time. We did a real brainstorming with the questions that you see here. What has been useful about the BESSI collaboration? What are activities that we could pursue before we have substantial amount of funding? What has not been so useful? What are barriers that you've experienced? And afterwards we went and we kind of sorted them into a few buckets, which kind of then look like this. It looks like we have broadly 5 areas of work that the BESSI community finds really very helpful. The first one is about framings. One really interesting point of debate last time, and actually it picks up on the conversation we just had, that there might be need to refine the BESSI pitch in a more positive way, rather than saying we're lacking, figure out a language that speaks to multiple disciplines, but also that speaks to policymakers and practitioners in a really obvious way. And I think there could be other ideas that could be built around this, often quite intensive thinking work about what framing and maybe a kind of manifesto type paper could look like on this. The second really important point was research community building. The need to really stretch this network, to have possible regional, thematic or trial working groups. So that's the area of how can we bring people together in a more effective way that is useful to everyone. The third one is engaging policy and practice. And we've just heard from Tim that it's not even just the current policymakers, but the future policymakers that we need to already be thinking about. The fourth one is the research agenda building. We've seen some insights on what that might look like right now from Atle, but lots of ideas have been mentioned even today on what could be a research agenda. And the last one is BESSI knowledge sharing, which is a lot of the things that have made BESSI what it is today, the website, the scorecard, the trial database, but yes, the idea to have compiled protocols and so on. So what we would like to spend maybe 15 minutes on in talking to each of you is these areas of work, what they could look like, how they might be interesting to you. And then of course we have an agenda, obviously, which is to say, well, are you interested in being particularly engaged, maybe even a driving force behind one of these agendas? So I guess the broad questions we want to ask for each of these buckets is, what are the priorities within this bucket? How should we sequence these priorities? And who has interest in taking particular elements forward? And the way we're going to do this is that I have put up these buckets as breakout rooms, and you can choose which one you want to go into. And at the same time, if you click on the link to the Jamboard, which I see some of you have been doing, if you click on the arrows at the top, each bucket has kind of its own Jamboard, and you can take notes and share ideas there while you discuss, which is a very, very useful record then to have for everyone afterwards. We don't then need to spend a lot of time rapporteuring. We can look at what groups have come up. So very informally, jot down points that come up, jot down your contact if you are particularly interested in taking some of this forward. So I think can you see the invitation to choose a breakout room? Has that been opened yet for you? Okay, no. So let me try this again.
Yeah, it has.
Okay, great. So obviously the BESSI core team, you know where to go, but everyone else, pick a breakout room. And if it's only 2 of you discussing, fantastic. At least you get to know each other well. And since I'm leading on research community building in this discussion, that's already good for me. So pick a breakout room and I'll bring everyone back in like 10, 12 minutes to see what we come up with. Is everyone successful in choosing a room? Yes, it looks like it. Fantastic. So Paul, if you go into BESSI knowledge sharing.
I can't see where the...
I can put you in it if you can't.
It's not coming up on my iPad. Yeah, okay.
Okay, good. Okay, fantastic. Chiara, Lars, Lau, and Lucas, are you happy to hang around here or are you having trouble joining?
Yeah, I'll stay here, so no problem.
Okay. Lars, is there, you want to hang around here or can I assist you in any way?
Well, I'm trying to. Yeah, I'm trying to figure it out. It's just
If you tell me where you want to go, I can
to the knowledge sharing. I think that makes
I can
sense.
teleport you. Okay, let me do that. Okay, safe travels. Okay. Right, welcome back, everyone. Action-packed morning. I want to, I haven't had a chance to look at anyone's Jamboard, and obviously we won't have time to do proper rapporteuring from each group. So what I would like to do is give a little bit of speaker's privilege to Tim, who has a fantastic and very concrete idea of how BESSI could directly interact with the WHO. And then if we have still a bit of time, get a bit of feedback from the various groups and look at the Jamboard. But Tim, maybe if you come back on to share your ideas of what we could concretely do.
Thank you. This was just an idea because of the research agenda discussion we had in our breakout. So we are organizing a global conference on PHSM end of August. And with different discussion items, streams. And one of them will be establishing a kind of a prioritized research agenda. So a list of research questions we feel that, hopefully could be sparking research, that is relevant over the next 24 months that, could be started by the research community. So we as WHO and as a community here can set out, a framework, what that could be, to also maybe help prioritize research funding to be channeled into these kind of areas. And the way we usually do is, we invite, for the submission of research question and then do a prioritization process. But what helps would be to set up a research frame, like 5 pillars, or these are the 5 categories where we could match this. And I was wondering if BESSI could write, such a frame, a one-pager or a background document that could fuse into. I already asked Atle for other background documents to support this conference, but if BESSI and a representative of BESSI could also attend that conference and then present, a frame where we can then match those, 500 research questions that might be submitted over time to categorize this and have, a flow. I developed a 2010 research agenda for influenza, and we also created 5 work streams with, where, you could put the research question there, and then, that helps also monitoring and tracking the implementation of the research. And so the ask to BESSI would be really, if you could come up with, what would be 5 streams of a research agenda, and also explain why and how that fits together in helping us progressing PHSM in the future. I think that will be a wonderful background document to infuse the expert discussion, and then have a representative of BESSI also there presenting and facilitating one of these working groups. Over.
Fantastic. Thank you, Tim. Susan.
Yeah, just to say, I think that's a great idea. And, we can definitely do that. We can ensure that's the focus of our work and get you something. So thank you very much for that idea. I realize we've only got a couple of minutes left, but I just want to say yes on behalf of all of us, because I can see everybody else nodding and thumbs up, etc.
Yeah, no, it's a fantastic.
Thank you. And I think, the more we can collaborate and develop in parallel, but with good links, the better.
Yeah, and I get the sense that it's exactly the kind of guardrail that actually will be really helpful for us. I wonder whether, I realize we have 2 minutes and we don't have much time to really talk about what was discussed in the working groups, but of course, cunningly, we had representatives from BESSI from the core group in everyone, so we can come back to this. But I wonder, Paul and Susan, whether you want to give us a 35-second overview of what was the most important points that came up in your groups.
Go ahead, Susan.
Okay, I can start. So we had Sandra, Joseph, Lai Wing, and Sophie, and myself. I think there was about 8 different points. So I will write up notes for us about the main points, because I won't do it justice. But I would say 3 main themes I'll pick out. One was engaging early, and how we engage and how we present what we're doing so it makes sense and is understandable and attractive to policymakers. The second thing is the importance of showing that what we do isn't just about communications. The BESSI's is much bigger, and it includes changing environments, changing motivation. It's not just about giving information, not just about communication. And the third thing was about evaluating, helping to evaluate the kind of interventions that policymakers are developing themselves, a lot of which are actually mass communication. They often don't get much wider, but frameworks and methods for evaluating that could help them improve and maybe think a bit broader in the future.
Wonderful, thank you. Paul.
So in our group, which was me, Lars and Ray, very small elite group, we discussed a whole series of things, but I think the idea we were discussing at the end was the idea of taking the current BESSI trials database, which has about 30 linkages in it at the moment, and trying to get, we're already writing to the authors, but asking their permission to reuse the protocols, but also suggesting that ways that we could improve the protocols, you know, getting other people to look at it, but also getting them to act as an advisor, particularly for the logistical issues that they will have learnt about that you won't see in the protocol. And if they were put up there as a volunteer to advise on anybody who's trying to reuse that protocol.
Fantastic. I'll race through the next step. So we'll take all of these ideas from today and develop a process to respond to Tim's wonderful ask to us, I guess. And as ever, I want to thank you all for your commitment and for your time and for your thoughts. And we hope that the next webinar, we haven't scheduled it yet because I guess we want to figure out what we will do. We'll continue this conversation and get a little bit more concrete in all our aims of building this community, but also really trying to strengthen this voice. And the input, the invitation from Tim is fantastic to do that. So thank you so much, Tim, for sharing all your insights and for the invitation. Thanks so much for everyone else. And I look forward to hearing from the rapporteurs more closely what was discussed, but I hope to see you all next time. So you'll hear from us as ever. Thank you. Have a very good rest of your day.
Bye.
Bye.